I'm here with Bonny Specker, epidemiologist from South Dakota State University, who is going to give us a mini Epi 101 lesson today about masking and also give us an update on everything that has been going on with COVID locally in our state, nationally, and in the world. What do you have for us today, Bonny?
Well, there were a couple things out that I thought would be good to update people on. One of them is this new CDC recommendation on cloth masks or face coverings. They are recommending community use of masks, and these are the ones that don't have the valve in them for a couple reasons. One of them is that it controls the source. So, we've always been thinking that you wear a mask to protect others. And that's because it reduces the emission of droplets that might contain the virus from both people who are asymptomatic or pre-symptomatic. And they might not be aware they're infectious to others. So we've been stressing that for a while, that a mask is worn to protect others, not you. Well, last week they came out with a statement that it's also good for your personal protection. And the way that it does that is it reduces the inhalation of those droplets by the person who's wearing the mask. So this is the first time that CDC has said it not only protects other people, it protects you as well. And they also emphasize that there is a community benefit of wearing masks, and that benefit increases as the number of people using masks wear them consistently and correctly. So if you talk about the source control, like control someone that's infected, preventing the spread, how that happens, they have been shown to effectively block large droplets. And they also block 50 to 70% of the fine droplets, the mist, the smaller aerosols. And not only that, they reduce the forward spread of those droplets that are not captured. So the droplets aren't going to go as far. And overall, about 80% of the respiratory droplets are blocked by using a face mask. And they go through and they provide references for the experiments that have found this. And the reference to this new recommendation is on the bottom of these slides if people would like to look at it. It's a really good article. As far as cloth masks being worn for personal protection, it's been found that it reduces the wearer's exposure through filtering of the fine droplets and particles. So they're not getting in from other people. And that multiple layers of cloth that have the high thread count, so they're really a tight weave, are better than those single layer, sort of loose cotton type materials. And they do discuss in these recommendations how cloth material may also affect the effectiveness of filtering, and that there should be more things done looking into breathability, comfort, and they talk about some of those issues. They also have a section on the effectiveness of community masking, and they give a whole variety of examples of observational and epidemiological studies that are mentioned. And I just list 3 of them here. There was one study that found that households with 1 or more confirmed COVID cases, that if the case and the family contacts both used masks before the patient developed symptoms, that it reduced the transmission of the virus by 79%, which is a fair amount. They also talk about a study where contacts who reported always wearing a mask in high-risk exposures had a 70% reduced risk of becoming infected compared to those people who did not wear masks. And then they also reference an outbreak on a aircraft carrier, the USS Theodore Roosevelt, where they showed that use of face coverings on board was associated with 70% reduced risk of contracting COVID. Then they talk about some of the community level studies. Now, those past studies that I just was talking about, they actually had information on individual people on whether they wore a mask or not and whether they developed COVID. When we say community level studies, what we're talking about is looking at, say, a city or a county and looking at the risk of COVID for the county and the mask wearing in that county. So you're not doing it on an individual basis, you're looking at it at a community level basis. But here they found 7 studies that followed directives for universal masking, that the infections in those studies, if in communities where they had directives, were reduced significantly. 2 of those studies and another analysis that they looked at actually found a decrease in death rates in communities that had masking mandates. The economic analysis, there was a study they cite showing that if you increased masking by 15%, you could reduce the need for lockdowns and reduced economic losses. So in countries where they are doing lockdowns, masking can prevent that. And in South Dakota, we don't have lockdowns, but it can still reduce, the outbreak and the number of new cases and hospitalizations, and maybe people will be less nervous about going out and spending their money in stores. The conclusions of these new recommendations is that there's experimental and epidemiological data that support wearing masks to reduce the spread of the SARS-CoV-2 virus. And the benefit is from combination of both source control, protecting the other people, and personal protection, protecting yourself if you're wearing that mask. The individual benefit increases with increasing community use. So the more people, the higher percent of the community that wears masks, the better, or the bigger the benefit. And that universal masking can help prevent the SARS-CoV-2 spread, especially when combined with other non-pharmaceutical interventions, such as social distancing, hand hygiene, and good ventilation. The other thing I just wanted to briefly mention, this came out, I have 2 references here at the bottom of this slide. One of them is an article in the Guardian newspaper, and the other reference is to the actual paper itself. But this is a preliminary results from a longitudinal study in Oxford and London. And when I say longitudinal, what that means is they're enrolling people and then following them forward in time. So, looking at them, what happens to them as time goes on. What they wanted to do was assess the long-term impact of COVID on 500 low-risk individuals. So these are relatively young people, and they have minimal pre-existing conditions, but they have ongoing symptoms. So they're not, after 10 days, back to where they were. They've reported these preliminary results on the first 200 patients, and that they have followed 4 months after the initial illness. And 42% of these 200 patients were reporting 10 or more symptoms 4 months out. 70% of them had mild impairments of 1 or more organs. And when I say 1 or more organs, what this study involved was a lot of blood tests to look at the function of lungs, liver, pancreas, heart. And they also did MRI imaging of these organs to look at whether or not there were any impairments physically. There were multiple organs affected in 25% of the people. And there is some indication that the people who are experiencing breathlessness or being chronically fatigued, those individuals were more likely to have heart and lung impairments than they were liver and pancreas. Like the liver and pancreas impairments were more related to gastrointestinal symptoms of COVID. So it's an interesting study, and it will be interesting to see what comes out of it. You know, how long do these symptoms last? Right now they're only 4 months out, but you know, when they get more patients and follow them further out. So that's the updates for the epi studies that are out there.
They're learning more and more as we go along. So it's really interesting to see everything that they're finding out the longer this goes on as they track that information and are able to actually study people and find out what's going on. But it's unfortunate to hear about the symptoms that people are experiencing after they've been considered recovered. It sounds like.
And it isn't thought to be a large percent of the people that have that long COVID, but you know, it is a fair amount, and it does happen in the young individuals that don't necessarily have underlying health conditions.
Well, what do you have for us today as far as what's been going on with COVID-19 across the state and locally and in our nation?
Well, so this is through yesterday, November 15th. Brookings County, I was flipping the last couple weeks whether I was showing cases versus hospitalizations or deaths. So today I thought I would show both. And again, these slides are available in the daily updates, so you can read them a little bit easier, but this I think provides a good picture where you can look at it real quick and see what's happening. Brookings County still is in substantial spread with 2,063 cases. There were 279 cases this week compared to 239 in the previous week. We had 550 active cases yesterday, and that was up from 453 the previous Sunday. There are 70 people that have been hospitalized. There were 12 new admissions this week compared to 11 in the previous week. There have been 13 total deaths, 4 deaths this week compared to 3 deaths in the previous week. And the test positivity among people tested is 40%, and among tests done, it's 21%. So it changes depending upon what that denominator is. And both of these numbers are quite high when you realize that the World Health Organization says that these should be below 5%. As far as the statewide, we have 65,381 cases, 9,977 cases this week compared to 8,080 in the previous week. We have 19,360 active cases yesterday, and that is up from 15,750 the previous Sunday. 3,644 people have been hospitalized. These are South Dakota residents. 460 admissions this week compared to 463 in the previous week. There were 553 individuals hospitalized in South Dakota with COVID yesterday. That's up from 546 last Sunday. There have been 644 total deaths, with 108 of these deaths this week compared to 99 in the previous week. And the test positivity here in the state is also very high, 58% among people who have been tested and 26 among tests done. And part of this is telling, you know, we really need to increase testing. And the state has started doing more community level testing. They have that anyone can get tested in different communities, and if someone's interested in that, they can go to the Department of Health website and look up the schedule, but that ends like in the next couple of days. So, you know, there's that. There's also High-V, so if anyone's worried about having possibly being positive and they might not have symptoms, they can always get tested at High-V for free, and that's a drive-up type testing. As far as South Dakota school situation, We continue to see increases in the numbers of K-12 students that are infected. That's that yellow line with the pink dot. 4,331 kids since back in August. The faculty or the staff in K-12 is the third line down here, 1,665. Here we have higher ed students, 2,202, and higher ed staff. So we do see increases more in K-12, with the staff being about half the number as the students, whereas in higher ed, the staff's about 1/10 of the number of the students. So these are all self-reported. As far as the US, there have been 11.2 million cases, a little over 1 million cases this week compared to 780,000 in the previous week. You can see this pretty dramatic increase here nationally. There have been 251,000 total deaths. That's 250,000 people, which I think is a hard thing for people to comprehend. Close to 8,000 deaths this week compared to 7,185 in the previous week. Worldwide, we have 54.3 million cases. About 4 million cases this past week were diagnosed compared to 3.88 million in the previous week. There have been 1.25 million deaths, 55,000 deaths this week compared to 45,000 in the previous week. So you can see the deaths worldwide are also increasing following the cases. As far as travel restrictions, this has not really changed for several months, but this week it has. Both California and Kansas now have imposed restrictions on South Dakotans. You have to quarantine or test negative. I don't think you can test negative in California, but I think you can in Kansas. But if you're planning on going to any of these states, it would be good to check this website. It tells you exactly what you need to do in order to not get fined. And some of the fines in these states are pretty hefty. And I thought I'd change my concluding slide a little bit. Given the new CDC recommendations, protect yourself and others, wear a mask, socially distance, wash your hands, and get tested, and we can get this under control.
Thank you, Bonnie. For those of you that are watching, if you have a question for Bonnie that you would like answered, please email us at the email address that's included in the comments below, and we will get back to you. Thank you so much for everything this week, Bonnie. I'll talk to you again next week.
Hey, thank you.